here at the University of Colorado Anschutz Medical Campus. If you aren't familiar with Accords, we are a transdisciplinary health services, health outcomes, and implementation research group based at the Anschutz Medical Campus in Aurora, Colorado. Madonna, do you mind moving that out of the screen, please? Thank you. And today we have almost the end of our sustainability seminar series, where we are talking about sustainability, cost, and value of healthcare innovations. And I'm sorry, Madonna, would you bring up just the intro slides? Sorry, we're working through some changes in our staffing here today. And before I introduce our speaker, I wanted to share just a little bit more about our upcoming sessions. Madonna, are you able to share those intro slides again? Thank you. Okay. So next month, our last seminar in our sustainability cost and value series will be Marsha Ori from Texas A&M, talking about a really fantastic start to finish example of growing and sustaining a healthcare innovation based on a falls prevention intervention program called Texercise. And as always, both today's seminar and those in the future can always be found on the Accords Education website. We have archives back several years, so if you'd like to see anything we have available, you can check out our Accords Education website. Next slide, please. And if you aren't yet registered for CopperCon, we still have about 6 weeks to go. And so May 24th to the 26th is CopperCon. It is our national, actually international, pragmatic research and health conference. We have 2 tracks. We have a dissemination implementation science track and a data science track. Come learn all about how to implement and conduct pragmatic research. And if you are a University of Colorado employee or a member of our CCTSI from an affiliate institution, you can attend for free. And the regular registration is $199 all the way up until when the conference starts. And you can get more information, look at our preliminary agenda, and register at coppercon.com. I believe that's the last slide. Yes, so registration is live. Okay. So it looks like we have, so for CopperCon, if you aren't yet registered, there's still an opportunity to register and apply for our early career investigator consultations. And then finally, at the end of today's session, there will be a seminar evaluation. We'll put the link in the chat at the end. We'll make sure we leave a few minutes at the end. We are very interested in getting your feedback and planning for future sessions. So with that, I will introduce today's speaker. And Dr. Lauren Hughes is an associate professor of family medicine here at the University of Colorado School of Medicine and the state policy director for our Farley Health Policy Center, where she leads initiatives to translate data for policymakers to inform the design and implementation of evidence-based health policy. Dr. Hughes previously served as Deputy Secretary for Health Innovation in the Pennsylvania Department of Health, where she launched the Pennsylvania Rural Health Model, a new payment and delivery model that transitions rural hospitals to multi-payer global budgets. She was also responsible for the launch of the Prescription Drug Monitoring Program for the Commonwealth of Pennsylvania. With that, I will turn it over to Dr. Hughes to tell us all about the use of policy and data to help inform sustainability strategies.
Wonderful. Thank you so much, Bethany. And please give me 1 second to pull up my slides. And I also want to let the audience know that due to poor internet bandwidth here in my home, I'm going to be off video for the presentation, and I'll come back on for Q&A. So again, thank you so much for the opportunity to present today. We'll be focused on how to ensure that your research can generate impact in the policy world. So thank you so much, Bethany, for the introduction. And I'm going to go a little bit deeper into introducing myself and talking about some of the influences that have led to my policy career and shaped the work that I do. And I'll be doing that by talking about the red stars and some of the arrows and the white dots as we go along. I'm going to start first with key policy influences. I'm originally from rural Iowa, hence the red star there. And growing up, I knew for sure that I wanted to pursue a career in medicine. And I very much appreciated the family physician that I had, Dr. J.R. Paulson, from the time I was born until I was 18 and left for college. And to be honest, I didn't think that there were other types of physicians until I was a senior in high school and my mother was diagnosed with breast cancer, and we necessarily needed to engage other members of the healthcare team in her care. What I appreciate about Dr. Paulson was not only that he was an excellent clinician, but he also was incredibly engaged in the community of Grinnell, Iowa, and it left an impression upon me of how important it is to have impact in your community through your work and through your clinical care. After I graduated from college at Iowa State University, I took a year to serve as an AmeriCorps volunteer at a federally qualified health center in Berkeley, California, hence the second red star. I had never been to California, so at that point in my life, as you can imagine, was quite an eye-opening experience for a native Iowa farm kid. And I loved it. And I fell in love with urban underserved populations. I fell in love with advocacy. I fell in love with interdisciplinary care training and delivery, engaging with community organizations to improve health and access to social services. And what I didn't realize I was also beginning to fall in love with, but just didn't have a name for it, was the work related to health policy. Coming out of that year, I knew that I wanted to incorporate a public health perspective in my career, and later pursued my MPH in health policy at the George Washington University in DC, taking a break in the midst of my medical school training at the University of Iowa to pursue that degree. And that leads me to the third star, which is in DC. And during the year I was pursuing my MPH, I had the incredible opportunity to really dive into the city as a classroom that is Washington, D.C., if you're interested in health policy work. You know, I was a student at the time and certainly appreciated and knew how to find the free food, right, for lunch. And so I go to AEI one day, the American Enterprise Institute, which tends to be right-leaning, and then I would go to Center for American Progress the next day, which tends to be left-leaning, and hear debates on the same health issue across the aisle. It was a very important part of my education. But the summer that I was wrapping up my degree, I had the incredible opportunity to intern for then Iowa Senator Tom Harkin. At the time, he was the chairman of the Senate Health, Education, Labor, and Pensions Committee, now since retired, but I loved working for him that summer. And I learned from Tom the very distinct differences between policy and politics. Admittedly, when I started my degree all those years ago, I conflated those two terms in my mind. They couldn't be more different, but they also couldn't be more interrelated. And if you want to move forward good policy, you have to be acutely aware of the political environment in which you are doing that. And from Tom, I appreciated and learned from him the art of compromise and collaboration when you are crafting sound policy and trying to run that through the political gauntlet to continue to move, as I have below here on the slide, move people and systems in a direction that you want them to go. And I also appreciated from working for Senator Harkin that summer how important it is to have clinicians engaged in the work of crafting policy, especially those with frontline experience, even if it's a part-time sort of clinical role. When I served in Harkin's office, mind you, I'd only completed 8 weeks of my third year of medical school. And staff members were asking me for medical advice, which was entirely ill-advised and perhaps inappropriate at that level of my training. But they were also sincerely asking me my insights as to whether, if this policy moved forward, how would it impact care delivery in the state of Iowa or the University of Iowa hospitals and clinics where I was a student. And so that work left a significant impression upon me. After I finished my training, so that was medical school in Iowa, the MPH degree at George Washington University. I finished my family medicine residency training at the University of Washington in Seattle, and my health services research fellowship through the Robert Wood Johnson Foundation Clinical Scholars Program at the University of Michigan. I assumed my role as Deputy Secretary for Health Innovation in the Pennsylvania Department of Health. And I absolutely loved the opportunity to serve at the state level. I really appreciate working at that level because you can drill down to the community and engage community members and stakeholders, but you also have the opportunity to be a voice of sort of that frontline reason and thought to the federal government, and you can roll up to that level as well. In my state government role, I was able to leverage my 3 degrees in clinical medicine, in policy and public health, and in research to really bring a 360-degree view to identifying and solving a wide array of policy problems that came our way. One of those, as Bethany mentioned, was the design and implementation of the Pennsylvania Rural Health Model, a new multi-payer global budget model for rural hospitals that is an active, ongoing experiment in Pennsylvania right now. And I will talk a little bit later on in the presentation today about overseeing the launch of the prescription drug monitoring program for Pennsylvania, which was an example of evidence-based policy and how to use existing evidence to inform the rollout of a new program. And now I have the great honor of being here in Colorado. I moved to Colorado 4 weeks before COVID hit, so a fascinating time to move to a new place. But I'm certainly enjoying being back in the academic environment in, right next door to the city, which is the state capital here in Colorado. And so it's fun to think about moving forward, being a bridge between academics and state government, because I understand the needs, the priorities, and the pressures that both governmental policymakers and academicians face. So let's take a big step back in terms of thinking about the policy big picture. I often find in my work in the policy space that policy and sometimes advocacy and lobbying might be confused as terms or might be interchanged. There's certainly areas of overlap, as you see here, and mind you, that's not it's not a proportionate sort of representation of the overlap, just to signify that there can be overlap in this work. When I think of policy, the definition that I bring to this is, the work of articulating problems and analyzing, designing, and/or researching potential solutions with the goal of creating sustainable change in an issue or issues that you care about. Advocacy is the art of educating stakeholders about a specific issue. This is often where individuals and organizations come into play, voicing their opinions about how a policy may impact them, their families, and/or their communities. And then lobbying represents the attempts to advance or influence specific legislation, either in support or opposition. So as you can see, they all are related to one another, but also are distinct activities. The red line that I have here is a visual reminder for me of where it is that I do not wish to cross, especially in my current work and my current role. I want to stay above that red line. And that red line for me represents objectivity in the policy work that I do. It also represents a line of, above that line is sort of the nonpartisan objective policy world. And especially coming from state government and re-entering the world of academics, I certainly appreciate in my work that I want to be an objective, nonpartisan, reliable, thoughtful resource for our state and other policy makers. If I were to cross that red line, it can be difficult to return above that line in terms of your credibility and being viewed as an objective, trusted partner to those policymakers. So let's talk about some of the dimensions of policy. When I think about health policy, I take a very big view on this, and policy for me is quite a large umbrella. So I think about it in these 4 different dimensions: levels of influence, different environments, approaches, and/or issues. So let's talk first about levels of influence. In your research or evaluation work, you may be focused at the local or perhaps institutional level. That's incredibly important. You may also be focused at the state level or the federal level. This is not to say that one level is more or less important than any other level. It's just important as you're thinking about your research and your evaluation and how to connect those findings to influencing policy. What is your sort of domain of influence that you wish to have, and that it's appropriate that you can speak to based on your findings? And I often also think about levels of influence in terms of little p versus big P policy. And I would wager that many of you may have heard this or use this phrase yourself. So little p policy being sort of local changes or institutional changes in policy, say in a clinic or in a healthcare system, versus big P policy if you're trying to draft or craft and pass legislation or doing regulation at the state or the federal level. Policy does not have to happen only in government, right? It can happen in academics, in research think tanks, associations, foundations, advocacy organizations. If you think about that big picture definition of policy that I had on one of my first slides, which is to move people and systems in a direction that you want them to go, each of these organizations have a role to play in that moving of people and systems forward. And then approaches. Another word for approaches you could use would be tools or levers as you think about how to engage in the work of policy. That certainly can be conducting research and or translating existing research or using those findings. That's a lot of where my world is now, as well as in engaging communities and stakeholders. When I was in state government, I certainly, I didn't have the bandwidth or the access to resources to conduct research or to do translation, but I certainly engaged communities, benefited from the existing research or policy products, was engaged in informing legislation and regulation, helping the Department of Health, where I worked, set budgets, and then designing and implementing new programs. The rural health model and the prescription drug monitoring program as two examples. And a 4th dimension of policy that's important to pay attention to are sort of the issues and timing thereof. It's really important to, as you delve into this work and want to increasingly connect your research findings to policy impact, is to appreciate when an issue is quote unquote a hot policy topic. Timing is essential, and you're not always going to get this right. And of course, none of us have the crystal ball, and it's going to be difficult sometimes to predict. And your research may ultimately line up time-wise or not. But if you get into the habit of trying to understand, if an issue is top of mind or a top priority for key decision makers, or if there's a lot of national attention, being placed on the issue, that's a good time to sort of focus your research and to try to strike those findings into a time frame that will impact policy. Let's talk about policy skill sets. These are 5 key policy skill sets that in my policy career to date, I have learned either formally or informally in sort of my educational, through my education or through sort of on the job training. The first is policy analysis, and this, in many ways, was one of the key skill sets that I learned formally when I was pursuing my MPH in health policy all those years ago, which is a process you go through to identify, compare, and prioritize potential solutions to a defined problem, with the ultimate goal of producing a memo or another document that, or similar document that could be presented to a decision maker. In the academic setting, when I was learning how to do this, my analyses were much more formal looking than what they were when I was doing this kind of, off the cuff in state government. Policy mapping is another skill set, and I use this term to refer to the conducting of a landscape analysis of different aspects of the policy that you are interested in informing or changing. So you want to know as much as possible about the issue itself. You want to understand what are the pain points? Where is it difficult for patients to access what they need? How can we help primary care providers better provide behavioral health services to their patients in the context of their clinic? If you break down those questions and understand where policies or programs get hung up, that's an example of a pain point that could be informed by the research that you are engaged in to help ultimately change a policy to alleviate those pain points. So mapping those out and understanding those in detail is really important. It's also important in this landscape analysis process to understand who are the key stakeholders, as well as your targets and or decision makers. You can have lots and lots of stakeholders, but not all of those stakeholders are necessarily in a place to have the authority or the agency to make decisions. You don't want to focus on one at the expense of the other, because stakeholders can be very useful as advocates and can be groups that take your research findings to then subsequently use to educate your decision makers. So doing all these kinds of activities together is what I refer to as policy mapping. The policy mapping, evidence-based policy, and communicating to policy audiences are highlighted in yellow because I will go into each of those in a bit more detail on the subsequent slides. When I think of these 5 skill sets, those 3 that are highlighted in yellow are the ones that I think are the most directly applicable to, I hope, to all of you today that are tuning in for this talk, because they are critical to engage in as you're thinking about connecting your research to policy impact. The third skill set that I have listed here is evidence-based policy. This I define as the production and or translation of high quality data and research to inform the design of policies, programs, and or products. As a clinician, I draw a lot of parallels between the practice of evidence-based medicine and the practice of evidence-based policy. As a family physician, I've been trained to bring the latest and greatest data and evidence to bear in the clinical decisions that I make in concert with my patients about their health and their health care. Why wouldn't we do the same thing in bringing the best data and evidence to bear in these policy discussions? Policy operationalization, the fourth skill set listed here, is really the implementation of policy, where rubber meets the road. So this is the brokering of numerous complex policy, political, and programmatic negotiations to move people and systems from ideas to action. A lot of the work, the second phase of the work that I did around the rural health model was all about operationalizing that and launching that model in Pennsylvania. And the fifth skill set is around communicating to policy audiences. I will make the case here that how you communicate to policy audiences is very different than how you communicate to scientific audiences, how you communicate to patients, how you communicate to community members, how you might communicate to the media or the press. So each of these different audiences requires a tailored approach to communicating your findings. When it comes to policy audiences, I like to think of this in terms of how do you package your data and research in a clear, accessible way for policymakers through a wide array of policy products. And we'll talk a little bit more about what some of those products can be. So a few more thoughts and details on policy mapping, again, which is to understand the policy landscape. Taking the time to do this thoroughly and or to partner with individuals that know policy, know these issues, will pay off tremendously for the fine tuning of the presentation, ultimately of your research findings to policymakers, but will also help you prioritize your research questions to make sure that they are the most policy relevant types of questions that you could be asking. When you're doing this landscape analysis work, it helps enrich your knowledge of the issue and what needs to be fixed or enhanced. Again, those pain points I talked about in the previous slide. Number two, it can help target focused, impactful research. Number three, it invites your stakeholders to be invested in and perhaps more importantly, anticipate your work and subsequent findings. So when is the right timing to do policy mapping? In my mind, you, in an ideal world, would do the policy mapping work as a precursor to developing your research proposal, or at the very least when developing your research proposal. So evidence-based policy, another one of the policy skill sets. Again, the ultimate goal here is to inform the design or implementation of evidence-based policy. And I offer these 4 questions for your consideration. As you are thinking about how to shape your research proposal, do you have a clear line of sight between your research and the policy or policies that you want to change, or the policy question that you want to inform? Understanding and being able to articulate that line of sight is very helpful so that your research team or your evaluation team understands what it is that they're ultimately trying to impact. And number 2, if you have that line of sight, so you have a clear sense of that policy question that you want to inform or that policy you want to change, and you think backward from that ultimate policy impact, do your research questions need to adapt in any way, anticipating that line of sight? In many cases, they may not. In some cases, they may need to be fine-tuned to make sure that they are the most policy relevant research questions that you could possibly ask. Are there experts in policy operationalization or implementation that you can invite to join your team? If you anticipate that your research or evaluation findings may inform the design of a policy that you would subsequently like to see implemented, it can be very useful early on to make sure that individuals who are skilled in the implementation of interventions are part of your team to help you, again, think of additional questions that you could ask, or questions that you may need to modify in your research or evaluation initiative. And last but not least, every so often as you're moving forward in your study, it is not a bad idea to sort of refresh your policy map and that policy landscape analysis that you have done throughout the course of your study. Policy can change pretty quickly insofar as much as the issue or the aspect of the issue changes, the stakeholders may evolve, the decision makers can change quickly. For those of us that are in academics, we tend to be in our roles or positions often longer than what our corresponding colleagues are in government or advocacy organizations or other types of environments. So communicating to policy audiences, important again to learn that this is a distinct skill set and that you can plan for these things from the very beginning, particularly in putting together research or evaluation proposals. Planning for the ultimate communication to policy audiences, which includes dissemination, means that you need to think about what is the budget for those activities up front as you're putting together your proposals. One of I think the most important sort of pieces of advice to impart on this particular topic or policy skill set is to really focus in and use anecdata. So this is a mashup of anecdote and data. We are, as human beings, we are relational, and we respond and connect to stories more so than we do to data, which is always hard for those of us that focus our career and our work on high quality research and evaluation. But if we want our great work to land and to impact policy, it's important that we incorporate the use of story to set priorities, to get the attention of policy makers, etc. And so learning how to blend stories and data is an effective tool for communicating to policy audiences. It's also important to be clear, simple, and straightforward, which can be very difficult because we spend a lot of time producing, for example, if we're doing a peer-reviewed piece or an article or a long report, that we've put a lot of time and attention into that work. It is incredibly important. It may not be the best way to communicate your messages to a policy audience, especially in state government, especially during a global pandemic. They're often not going to have the time or the bandwidth to focus in on a multi-page, peer-reviewed document. And so being clear, simple, straightforward, to the point is essential for getting the attention of a policy maker or decision maker. You hook them in. If they want more information, they'll be very willing to go deeper into the issue with you. The next point I want to spend a little bit of time on, which is it's important, especially if we're in academic environments as researchers or evaluators. And if you have a relationship that you have formulated with policymakers or decision makers, and they're asking you for evidence to inform what they're doing, it may be uncomfortable in some instances because you don't yet have a clear enough answer. You don't have the best available data in your mind relative to your work. It's important to appreciate that in the policy world, when I was in state government, every single day, I had to make decisions using the best available evidence and data that I had. Not the best ever, because my timeline didn't match up with what it might require to get the even better data to help me make that decision. So often I find that for academicians working with policymakers, that this can be the greatest challenge because the academician wants to wait longer to make sure they give them the best available evidence. And in the policy world, I need what you know right now. In fact, it would have been better if I would have known that information yesterday. You also want to plan for what you think the best policy product would be for communicating your findings. When you're doing your policy mapping, you also get a sense of how your stakeholders or decision makers consume information. So that can help guide the type of policy product that you might produce. These are 3 out of many types of examples. So an infographic, a policy brief, a brief report are all different types of policy products that can be useful in conveying your messages. And then last but not least, as a researcher or as an evaluator, you are going to gain a lot of favor and high regard and attention from policymakers if you are very nuanced in the presentation of policy solutions and present what I like to call elegant policy solutions. So what do I mean by elegant policy solutions? I mean the following. 1, it's important for you to build upon what exists or what's in motion. It's not that you can't present new solutions, but it's important to realize that, you're more likely going to see a solution move forward if it's an extension of what currently exists or it builds on infrastructure that's already there than it is to launch a brand new program. Number two, if you know what has already been tried in this arena and understand why some aspects of it did or didn't work, that will help you present more nuanced policy thinking in the solutions that you offer up. Important to also understand the decision maker's authority and the political will around certain issues. So if you're presenting research and data to a decision maker, you want to make sure that you know that you are matching that evidence with the best person that will actually have the authority to use that and to move that work forward. It's also important to appreciate the proposed timeline and available resources and where your issue that you're trying to inform kind of fits into the priority list for whether it's the governor or for other agency leaders in state government. That will also help you present sort of nuanced policy solutions. And it's also important to respect the politics of now. So right now where we sit, as we are starting to enter a recovery phase after a pandemic that has impacted our lives in untold numbers of ways in our economy and in our education and so many other dimensions of our lives, it's important to understand who is emerging as a hero from the past year. And certainly hospitals and frontline healthcare workers are emerging as some of the many heroes of the past year. Some of the work that I am focused on right now in my own policy research is around graduate medical education, financing, and governance reform. Some of the stakeholders that we interviewed as part of our study, were suggesting that maybe we need to fine-tune GME by moving money from the money that comes to the hospitals and having some of that money go to the communities for training directly in the community. As you can appreciate, though, that right now, if hospitals are some of the darlings of COVID-19, that to present solutions that would take money from hospitals and redirect those funds may not be the most well received at this point in time. So I want to provide you an example from my previous work in Pennsylvania, which is around the prescription drug monitoring program. This, as I look back at my work at the state, is an excellent example of how to move forward evidence-based policy. Before I started my state service in 2015, Act 191 of 2014 was passed, which provided for the creation of a tool that contains dispensation data of controlled substances, Schedules 2 through 5. The ultimate goal for this tool is to help prescribers and dispensers make evidence-informed decisions with regard to prescribing and to aid regulatory and law enforcement agencies in combating fraud, abuse, and diversion. In my first year of the PDMP and getting it launched, I encouraged my team to do two things. The first of which is to focus on building a trustworthy, reliable database. And it was so tempting, before we turned our attention to other programs we wanted to offer related to the opioid and heroin epidemic and how to curb it. So things like creating a research program or offering educational modules or, et cetera. We needed to build first a reliable database in order for our clinicians and other healthcare providers across Pennsylvania be able to trust the tool, first and foremost. And then secondly, as you see at the top of the slide on the right-hand side, Pennsylvania, as it turned out, was the 49th state or commonwealth to pass legislation to create a PDMP. So at this point, we had 48 other peers that were ahead of us in this realm. So there was absolutely no need for us to reinvent the wheel as we rolled out the PDMP. So I encourage my team to go to the best available data and evidence that we had at that time to inform how we were going to roll out the PDMP. So we turned to peer-reviewed literature to review the benefits of PDMP use. This helped us develop messaging to facilitate clinician adoption of the tool. Number two, we conducted informal key informant interviews with PDMP administrators from other states who also were working with our vendor. And we learned from them some of the successes and challenges they had in getting the PDMP off the ground that informed our work. And then we also took advantage of a training and technical assistance center at Brandeis for their various analyses that they had done related to PDMP use in healthcare systems. And this included maps, legislation trackers, and best practice checklists that were, in essence, policy products that had been created for the very purpose that we were using them to inform how we were going to design and implement our PDMP program in Pennsylvania. And we also engaged peer agencies, community-based organizations, and physicians and pharmacists in sort of informal rapid learning cycles to identify, design, and experiment with PDMP enhancements as we move the program forward. This program highlights how grateful I am to have the health services research background, particularly in working in policy, because it helps me understand where to go to this information, who to talk to, and how to leverage information to inform policy and program development and implementation. The PDMP launched in August of 2016 after it was a mad 5 to 6 months of getting it ready to launch. And by the time I left state service, more than 110,000 healthcare providers across the Commonwealth of Pennsylvania had registered to and were actively using the PDMP. So I want to talk briefly about policy change and sustainability of interventions. And following the train of thought from the past couple of slides about the Pennsylvania PDMP, our intervention goal was to make it as seamless as possible for providers to use the PDMP tool. This was after the first year we had the tool up and running. Providers were getting more familiar with it, and they were trusting the data within it. At that point, it was still a standalone tool, which meant that if you were in your electronic health record, the provider had to leave the EHR, open up a web browser, and log into the PDMP tool. As you can imagine, not very efficient if you're a busy clinician. So the policy change that we wanted to see is how can we incorporate the PDMP into EHRs so that it was a more seamless use of the tool. And to help move forward this policy and programmatic change, this is an example of going after dollars, in this case, federal dollars from the CDC and other funders to create an incentive structure for health systems across Pennsylvania to incorporate the PDMP into EHRs. And I think of all of the changes that we made after the launch of the tool itself, this is, I think, by far the one that has been the most, or was the most popular, because it made the PDMP tool much easier to use for clinicians. Another example that I'm sure many of you that are tuning in today are engaged with, which is around screening for social determinants of health, and how do you connect patients and families to services that they need. In our current fee-for-service world, as many of you know, this is challenging because this kind of work is generally a non-billable service, even though making sure that our patients and families have a place to live, have transportation to get to work, have a job that pays well and has benefits, and all of these sorts of things has tremendous impact on one's health and well-being. It's just challenging to make that act of screening and connecting people to services difficult in our current fee-for-service world. A policy change that could allow the sustainability of this type of intervention is all the experimentation, in large part fueled by the CMS Innovation Center that has been now around for a decade, in alternative payment models, because they provide a potential pathway toward greater sustainability of these types of services as we move forward. And last slide here, and that I'm excited to hear what questions that you might have. I wanted to share with you some policy lessons that I have learned along the way in my career, and I hope that these will help provide some additional perspective on how important it is for researchers and policymakers to be partners in moving forward the design and implementation and evaluation of evidence-based policy. So the first, policy versus politics, I touched upon this when I was talking about my time serving as an intern for Senator Harkin. They are obviously not the same thing, but they are interrelated. And if you want to be adept at crafting novel, thoughtful policy moving forward, you do have to pay enough attention to the political environment to understand how your policy is going to land, who you need to work with, how it might need to be compromised for it to move forward. So these are the types of thoughts and questions that are going to be on policymakers' minds when you come and present information to them. Procedures and processes. Certainly, if you are not as keenly interested in policy, especially how policy is crafted and moves forward in state government, this may not be as exciting to you. So the nitty-gritties of how you actually move forward legislation, for example, at the state level, it can get pretty wonky. But if you are able to understand just enough to be slightly dangerous in this realm, it will pay off well for you in knowing how to fine-tune some of the evidence you present, or how to prioritize it, or solutions you might be offering up to policy makers. So procedures and processes, what I mean by this are the specific tools at your disposal and the culture that you have to navigate or respect to get work done. Academic medicine has its own culture, and that culture is very different from one academic medical center to the next. State governments have their own culture. And if you're not a part of it or haven't been a part of it, you may not understand it, or you may think it's not efficient, or it's not this or not that. But understanding enough about it will help you become a trusted resource and partner moving forward. Patience. Rarely policy change is fast. Sometimes it is, and everyone is left scratching their head wondering what in the world just happened. But it's often not fast. And for those of us on the academic side of things, we have to appreciate that the responsibility for, and perhaps more of the burden of, educating and re-educating and re-educating again stakeholders and policymakers on issues and the latest data and evidence is largely going to fall to us in that relationship. But that is kind of part and parcel for this work, because we tend to be in our roles longer than what our colleagues, and sort of the cyclical nature of government, particularly if you are in the appointee realm and not in civil service. Persistence. You have to love the issue or issues enough, or perhaps another way to think about this, they have to make you angry enough to stick with it when times get tough. Trying to translate evidence and research and connect that to policy is not always fun. It's not always glamorous, but when you can get something moved and you know that your work and your research and your evaluation findings were connected to that change, it's really incredible. And last but not least, perspective. It's really important in the policy world, whether you're coming from the say government side or another entity, or from academics, to appreciate and get to know and understand the needs and priorities and pressures that your stakeholders in this environment around the issue you're trying to change, what they're facing. Understand the timelines, for example, between academic research and policy formulation are very different. And in all cases, it's incredibly important to be an honest broker. If you're asked questions by policy or decision makers and you either don't have the answer or you don't know, just be honest about that, but offer to serve as a resource to help connect them to someone who does know or to find that information for you. They will remember that the next time that they have a question and want to reach out. You will be a trusted resource. So when is the best time to consider the policy implications of your research? I certainly hope I've made the argument today that thinking about them from the very beginning is the best time to consider the implications for policy. I've often found that for a lot of my colleagues that are engaged in research and evaluation, it's not that policy isn't important, but they don't think about it perhaps until later on, or the study is already underway, or when it comes time to sort of package their findings, they want to think about the policy impact then. It's still possible to have that, but it may be even, you could leverage it for even greater change if it's earlier on in the process. So thank you very much. I'm going to stop sharing my slides and look forward to questions. Let me turn my video on and hopefully it won't freeze. So.
Oh, thank you so much, Dr. Hughes. That was fantastic. Such a great coverage of all of the different ways that we might need to think about policy in the context of our research. And I'm hearing you that we should do it sooner rather than later. We should really be thinking about policymakers as one of our stakeholder types early. So we do have a number of questions. So first, there's a couple of questions that relate to how do you figure out who your audience is, the specific individuals that you should be communicating with and to, and then who are your champions in that process? How do you do that?
Great question. I would say if you're focused on a particular issue, for example, I think the easiest place to start if you want to connect your research to policy impact is to identify, just kind of do basic, if you don't already know, basic Google search to figure out who are the key advocacy organizations related to this issue that are trying to drive it forward in your particular state. Those organizations will generally know well, if you don't already have a connection to the key decision makers at the state level, they'll know who those targets are more likely than you. And so then you've kind of killed two birds with one stone because you've connected to advocacy organizations who and then in turn can connect you to the decision makers at the state. So if I were trying to do a policy mapping exercise for the first time on a new issue, that's how I would approach it.
And then a number of questions are about the communication channels. How do you actually reach those policymakers, and what's the best way to get to them in a way that they'll actually listen and take you seriously?
Another excellent question. And this comes down to first, working hard to establish the relationship with these decision makers. And so you can get to that first through your policy mapping exercise. And then every so often, it could just be as simple as it's relationship management, just like you would manage a relationship with a funder or manage a relationship with patients and families if you're in the clinical setting or what have you, is once you know who those decision makers are, maybe once a month, reach out to them, drop them an email, let them know how your study is coming along, ask if you can help them with anything. Do they need resources? Hey, there's an invitation to this conference related to the work you're doing at the state. I wanted to share this with you. Be a resource and be a genuine partner in that relationship. It makes it so when it's time to package and share your findings, they're going to be much more receptive and willing to circulate and distribute those findings on your behalf.
So I'm hearing that you don't need to have this beautiful package every time you reach out to the policymakers. It can be little tidbits along the way.
Not at all, because you're not going to have that likely until the very end when you're ready to pull all those findings together into policy products. And so it's just these little touches here and there, just to let them know that you're still there and that you're a resource for them, and you want to genuinely help them do their job better.
That answer you just gave, I think, answers a number of the questions people are asking about who and how and when. I mean, I'm hearing you say you can just email people and it's basically their job to listen.
Exactly. Our taxpayers pay their salaries. We butter their bread. So if you're trying to impact policy at the state level, we're their constituents. So, and here you're being a constituent that's not coming to them necessarily with a complaint or a question or a this or that. You're coming to them as a partner and offering them a resource. That is going to be very refreshing to the person receiving that email.
Yes. There was one question. Is starting with the staffers a good way to start building that relationship?
Absolutely. Especially staffers are important, especially if they are staffers that are careerists. So, not necessarily the political appointees. The political appointees come and go, and you want to make sure that you need to have relationships that kind of span the mix. So, if you can find senior level administrators in a particular agency that's important to your work, that are civil service or might be there for a long time, those are the people that you really want to get to know. And you also want to know the political appointees because they're there for a short time. They are motivated to do something and to have impact, which means that if it's an issue related to what you're working on, you're researching or evaluating, things may move a little bit quicker and you have a policy window to make an impact.
How do you know when that policy window is?
So it's a great question. It's a sort of a variety of, of inputs. So listen to, what is the governor, what's the governor or the senior executives of agencies saying is important to them, right? Are there referendums coming up from voters? What's the tone of the national conversation? Like right now, rural is hot. And it has been for the past, 4 years or so, 4 or 5 years. Health equity is hot right now because of where we are as a nation and what we're struggling with. So you want to pay attention to, what's a national conversation? What are the priorities, both politically and personally? And especially if some of those stakeholders that you want to work with have any future interest in running for office themselves, you really want to get to know what their priorities are, because if they relate to your work, it could be a tremendous opportunity to get something moved because they want to have that as part of their platform moving forward. So it's a variety of different inputs.
Well, we're almost out of time. There's an important question here around policy mapping templates, tools, any sort of resources. Perhaps if you have some suggestions, you could send them to me and we can send them out to everyone as part of the archiving.
Yeah,
right?
No, absolutely. Happy to do that. I do it a little bit differently each time, depending on the issue, but I would certainly be pleased to look for some templates just to give you a visual sense of what it is I'm talking about.
Wonderful. Well, thank you so much, Dr. Hughes, and thank you, Madonna, for jumping in and helping us with today's session. I really appreciate everyone attending today and sending in your really wonderful questions. And like I said, we'll send out an email afterwards with letting you know when the recording is available, and also sending along some resources and templates for doing policy mapping. Thank you, everybody. Have a great day.
Thank you.